three areas. PPE, I would only want to highlight PPE because, again, I do get concerns from care home providers and also domiciliary care providers regarding PPE. And it's important, I think, that we ensure they have sufficient levels. And I do think the guidance can be strengthened from Public Health Wales, because if you're in a lockdown situation, a care home is likely to be receive infection because of an asymptomatic member of staff coming in with the virus and pass it on. So they should actually be using PPE at all points in time, not just when a case occurs within that home. So perhaps you could strengthen PHW's advice on guidance on that. And also in care homes, I appreciate the website coming through, and which will make things easier. But can you also look at ensuring that it's easier now for care home providers to have referrals by simply asking the council to do it directly rather than go through PHW, which is causing more concern for some of the care home providers where members of staff are symptomatic and they want them tested. And a direct referral from the council or to the council may help that. And finally, I very much appreciate what you said, Doreen Appiorworth, in relation to your discussions with health boards as to preparations to introduce other treatments relating to the provision of COVID, non-COVID issues. But I've also received information that cancer referrals from GPs in other parts of the UK in some areas have gone down by 75%. Are we aware as to what percentage of cancer referrals, urgent cancer referrals from GPs have changed? And will you look into this matter? Because it could be that patients are not wanting to go to GPs at this point in time. It could be because GPs are being advised, certain types of conditions will only be met, and they are therefore hesitant to refer themselves. We need to ensure that those who receive that type of urgency are not delayed as a matter of a fear for overburdening the health system at this point in time.
Minister.
Thank you for the question. I want to reiterate on PPE, the point about the guidance needing to be followed. The last thing that we need to do is to encourage people to use PPE in larger quantities outside the guidance, because whilst that might provide some people who don't need it with more confidence, it will take away the supply from our frontline staff who really do. But we need to make sure that each one of our frontline settings, including residential and domiciliary care, where they need to use PPE, have access to it. That's why we're taking the extraordinary steps of using our public resources to provide PPE to independent businesses. We would not normally do that. If in normal times we were providing free of charge PPE to those going concerns, and people would have an entirely different set of questions. But it demonstrates this once in a century threat that we are confronted with and the way that we are responding. On the process of referrals, I'm happy to report that that has already improved. And as I've said, we've heard directly from local government that a much larger number of referrals are being made from workers in the care sector. It's important to me those aren't just people employed by local authorities directly, but people in the independent sector, as Diaries highlights. So we need to make sure that they have referrals that are speeded through, whether through the local authority or directly, to make sure that they're provided with a test and promptly. And again, the figures that we published today should give some confidence that those results are then provided quickly. On the particular point on cancer referrals, I recognise Diaries' long-standing interest in the work of the country on improving cancer outcomes, and it's one of the things that I am concerned about, to make sure that urgent referrals where urgent care is needed don't get put to one side. That's already what I've asked the service to look into. It's part of my concern to understand accurately the picture, and then not just to present that picture, but actually to do something about it, to encourage people to come forward to address their very real healthcare need, because as we know, late referral, late recognition of cancer often leads to much more radical treatment and actually compromises the best prospect of people having a good outcome. So they're definitely points that I want to take up, and you'll hear more from me over the coming weeks on the work that is being done to do just that, and I hope that provides an answer to Di's question.
Neil McAvoy.